Welcome to this edition of Platform. I am Muhammad Kudu Abubakar. The federal government has continued to relax the total lockdown it imposed on the Federal Capital Territory, FCT, Lagos and Ogun states to contain the coronavirus pandemic. Food markets now open from 10 a.m. to 2 p.m. every day, and the supermarkets and pharmacies now open from 10 a.m. to 4 p.m. every day, but with a proviso that they maintain a high level of hygiene. The new guidelines also ban bus services during the lockdown. It is now illegal to allow a mass gathering of more than 20 people. All these are against the rise of COVID-19 cases to 174 across Nigeria as at Wednesday, April 1st, 2020. This edition of Platform examines the federal government's strategies of containing the coronavirus and challenges. Our guest is the Minister of State for Health, Senator Olonumbe Mamora, a former Speaker, Lagos State House of Assembly, and two-term senator who represented Lagos East Senatorial District 2007 to 2015, and a medical doctor by training. Senator Olonumbe Mamora, Minister of State for Health, welcome to Platform.
Thank you very much for inviting me.
And thank you for accepting to be here, Honorable Minister. As usual, on the panelists section, we have Rabi Abdullah, NTA's Head of Health Desk.
It's a pleasure to be here.
And of course, we have our regular panelist, Ruth Aguele.
Thank you very much.
Of the NTA's Current Affairs Unit. Honorable Minister of State for Health, Senator Olorunmbe Mamora, welcome once again to Platform.
Thank you.
Let us begin this conversation by taking Nigerians back to this immediate past, if we like, or let's put it, since the manifestation of the coronavirus itself. How has the federal government, what strategies did it adopt so far, and how did it begin the containment?
All right, thank you very much. You will recall that when this thing broke in China, Wuhan, we started preparing here because the way the virus was spreading then naturally gave the entire world, so to speak, cause for concern. So we in Nigeria, we started preparing. And what was that preparation? The emergency operation centers were activated, as well as the National Emergency Operation Center, which is the coordinating body at the national level, and of course, under the Ministry of Health, but as managed and directed by the Nigeria Center for Disease Control. And when the situation in China was escalating, and of course getting out of the country, then what we activated, it became inevitable for us to escalate it. That is, be on the lookout. You will recall that we started by monitoring particularly the flights coming into Nigeria, believing very strongly that if we were to have our first case, that is index case, most likely it will be through airport, that is air point of entry, if you like, as opposed to land, border, or the sea point of entry. So, what did we do? We alerted the port health officials to put in place thermal scanners so that passengers coming in can be scanned in terms of their body temperature, which is one of the first things that will come up when you are infected. That is high body temperature to the level of fever, that is about 38 degrees centigrade. The fever is simply elevation of body temperature above the limit of normal. And of course, when that happens, it does not say that, yes, you have a coronavirus disease. You will recall that it was along the line that WHO sat down to now designate it as COVID-19. Hitherto, it was just known as coronavirus disease. Now, in addition to that, the port's health officials were to also do what we call visual observation. That because even not being a medical person or health official, if you see somebody that looks ill, you may be able to say, oh, this person is not looking well. So that is visual observation. In addition to checking the temperature. And of course, if temperature is high or the person looks ill, there's a holding room where that person will be further interrogated to know the travel history, to know whether that person is on medications, to know whether there are other symptoms that are not, readily obvious as at that point in time. Okay,
Honorable Minister, we had done all of that just to checkmate the importation of COVID-19 into the country. We started from where all our efforts were geared towards more of that prevention, but a lot of things had happened where, at a stage now where we have to deal with still prevention, we have to deal, step up our responses, and we're dealing with containing and just containing it and, putting a halt. We've been reporting cases, and as the days go by, we just keep, reporting cases. Where did we get it wrong? Is it about the attitude of Nigerians themselves or a lacuna that gave rise to where we are today?
Well, Rabi, I may not say that we got it wrong, but that is not to say you don't have a point in terms of attitude of our people. You recall that as part of the containment is this social distancing. And the whole essence of social distancing is to limit contact. Because we know that if there is no contact, the chances of getting the infection are limited. So that is why the issue of social distancing becomes very, very critical. Aside the other basic measures like personal hygiene, and particularly as it has to do with hand washing with soap and water on the running water, and of course the use of alcohol-based sanitizer. That's also important. Of course, the respiratory hygiene, where we ask people to cover up when you sneeze, when you cough, and if you do not have handkerchief or towel, paper towel, you cough into the bent elbow. Now, you discover that not everybody is observing all this. And don't forget our culture is such that we tend to want to bond as much as possible. Exactly. So people are still trying to have parties and all that until we are now seeing the devastating effect of this is because the countries, don't forget, we also need to take advantage of the experience of other countries that experienced these things before us. So we need to take all this on board and ensure that we do what is right and we follow the directives. We said people should not travel, particularly to the high burden countries. Some of our people still travel, and some people still came in from some of the. These are some of the. That's why I told Rabi earlier on that some kind of attitude again. That is, we must learn to listen to directives, to advisories, and the like.
But following what she said, from the start, we were just dealing with an index case. And yes. I know that there are processes before this whole spread became something we're trying to deal with now. It starts with active surveillance, then early detection, isolation, case management, then contact tracing. Would you say it was quite challenging, or it is still challenging for Nigeria because the numbers are increasing? If at a time we're dealing with just an index case and today we're counting 100.
174.
There is no doubt that it's challenging. I mean, I must admit, it's challenging. A few days ago, the DG, Director General of Center for Disease Control, did say that we had about 6,500 contacts that we were trying to trace. And you know, the whole thing is dynamic. And the more cases you detect, that is through PCR testing, and you confirm, that means that case has also had some contact. So that is added to what you have on ground. And of course, contact tracing is not an easy thing because you need logistics in terms of transport, in terms of personnel, in terms of everything. So we are challenged. There's no doubt about that. And particularly, you know, in Lagos and Abuja that have the high numbers that we are
what will you say
talking
to
about.
some people who are saying, as we observe the lockdown, there should be scaling up of the process of testing?
Well, you see, there is no doubt that, as she rightly mentioned, that is detection. And you cannot confirm that somebody is positive or negative without testing. But having said that, we must also take on board the realities that exist in our own country. I was listening to a program earlier today, and from WHO, and one of the top shots, they say that in all this, each country will have to be innovative, will have to be adaptive, will have to be flexible.
That takes me
in approach.
Okay, sir.
So testing is critical. But unfortunately, we are just expanding now our testing capability in terms of the PCR testing mode, which is what we adopt because it's the most reliable. There have been issues of rapid testing kits and all that all over the place. But as a policy for now, we have not adopted the rapid testing kit mode of testing because not very large.
So how many TCR centers do you have now in the
We have 7 right now.
Where?
We have in Lagos, the Lagos University Teaching Hospital. We have the Nigerian Institute of Medical Research in Yaba. We have in Oshun, that's the African Center for Genomic Studies in Ede in Oshun State. We have in Abuja, which is National Reference Laboratory, that's domiciled at NCDC. Then we have Irua Teaching Hospital in Edo. And then we have a new center just opened in UCH, Ibadan, and the one in Abakaliki.
Sorry, sir, that takes me to the next question. If you recall, during one of the ministerial daily briefing on COVID-19, I had asked this question then. That was when we had just 5 laboratories, and I wasn't comfortable, with the spread, because I noticed that for just geographically anyway, for Lagos you had 2, one in Oshun, still southwest, you had Edo, south, and my question then, and you have one.
No, you have Lagos and Yaba.
Yes, you have you have 2, 2 in Lagos, then 1 in Oshun, 1 in Edo, then the 5th one in the FCT. And my question then and my observation revolved around the fact that you had 5 laboratories then, which I felt were not, evenly, spread. I looked at, the map. None, because for people in the northeast, means they have to probably fall back on the one in the FCT. You have Northwest Kano with the population. I'm still saying that we've expanded now. We've added one in that's Ibadan, that's Oyo, which is still Southwest, and you have one in Ebonyi, Abakaliki. What is the issue around here now? Because the infection is spreading, the virus is spreading like wildfire. What is the fate of the people from the northwest, northeast,
North Central?
And even, North Central. No, Abuja could say to be serving North Central. I'm still saying, what are the issues? Because I have said, don't we have facilities that could readily be converted to serve this purpose?
Rabbi, you see, your observation is right. But I can assure you that efforts are being made right now to look at those institutions that have developed the capacity for testing. Some of them are already on ground. And you see, the PCR, what we call polymerase chain reaction, the testing mechanism. Some of the institutions around, they have this facility on ground, but they only need to configure the machine to be able to carry out this test. And of course, we will now have to get the reagent. So if and when these laboratories that also are in existence are supposed to start from the scratch, because to really start from the scratch and build a laboratory that will have that capacity, it will cost not less than about 150 million.
But
so it's not even that cost. But we are looking at those who already have the testing capability, that capability, that only that the machine will have to be reconfigured.
So the government is not thinking of having a mobile testing, if you like, facility?
Well, not now, because of what is involved. Because apart from having this capability in terms of the machine, and you also need the competence of the laboratory scientists, because they are specialized. They are not the routine kind of tests in the lab. But you need those who are qualified and experienced. When we started,
so what logistics now? Honorable Minister, let's come back to this issue. What logistics is the ministry and the Center for Disease Control putting in place to make sure this issue of logistical distance that Rabi has pointed out is reduced to the bearers minimum, if there are the need for tests and cases from the far northeast and the far northwest?
Yes, I was going to say that even initially, before we got to this point, no laboratory in Nigeria had that capacity initially. The first few cases that we had to test, the samples were taken to South Africa through the help of WHO and other. But the reagents, when the reagents now became available and some of the existing centers had their machines reconfigured to handle, then we started testing. And of course, there are plans in place to expand that facility, that is to test. Hitherto, and even in some of the centers up to now, the samples, they have been transported by a courier company, a specialized courier company that has the capacity to handle samples of such very, very significant,
sensitivity.
Yes, sensitivity.
But do we even have enough test kits? Because if you're thinking of expanding these laboratories, what about the test kits? If we're looking at the logistics involved,
we don't have enough, and no country, not even the United States, has enough because no country has it. That's true.
So how will it come into place if we're going to expand these laboratories?
That is why what we are doing now is what you can call targeted testing. Because you see, one of the things I can understand.
What do you mean by targeted?
I'm going to explain that. I can understand the anxiety of people. You see a lot of people now, we take calls virtually every minute. I want to be tested. I think I have been exposed to somebody.
People are getting paranoid.
So that is it. So there is a lot of fear all over the place. Oh, I got in contact with somebody. or some. We can even understand somebody who is saying, "Oh, I was in contact with this person that has tested positive." But you have people, the slightest cough now is associated with COVID-19. So, and this is the anxiety. So when we now say targeted testing, we are talking of people that fit into what we call the case definition. And what is the case definition? They have fever, they are coughing, they are having difficulty in breathing, and on top of it all, maybe they have come in contact with somebody that has tested positive, or they are people arriving from high burden countries. So those are the people that we will give priority to, and that's why we call it targeted testing. As opposed to people, if somebody comes in and says, "Oh, I think I have come in contact with somebody that has tested positive," we say, "Just hold on, go into self-isolation, observe yourself. If you start developing symptoms that we can now say this fitting into our case definition, then we will come for you."
But
So that's why I said, because we don't have enough capacity and testing materials to go around.
But from
everybody.
But from what you're saying,
Yes.
it's like the population, it's bringing the burden on it, from what you're saying. But are there other means, like collaboration with other countries? Because if we look at the multifaceted nature of the virus and the impact it's having on the economy presently, globally, everywhere, not just Nigeria, any collaboration with other nations? Because this is the time nations should come together.
Definitely. If you recall that when this thing was getting escalated, there was a meeting of ministers of health of the ECOWAS sub-region. I was the one who attended that meeting in Bamako, Mali. Thereafter, because the Honorable Minister of Health was somewhere there, thereafter there was another meeting organized by the AU, African Union, in Addis Ababa, which the Honorable Minister himself attended. So this collaboration is always there, because no person has all the answers, and because this is a novel, you recall the initial name was novel coronavirus, because it's new, and the behavior of the virus, even as so much is known now, so much is still unknown about it. Then that quickly brings me to the issue of this a mask. Some people will argue that, look, if you're not showing any symptoms, you don't have to wear a mask. But we cannot, some people are still saying that this thing could be airborne, aerosol, transmitted. So there are still arguments here and there. So the opinion is, the concern is that, look, if you feel you'll be protecting yourself and protecting other people like you, around you, then you can go ahead.
Now we're on the issue of the mask. Let me observe that your mask appears different from we, the ordinary persons on. That's number one. Number two, the Cross River State governor, Professor Ayade, is quoted to have said that in Cross River, as far as is concerned, no nose mask, no movement. Will the federal government adopt that in the areas that are now under lockdown?
Well, you see, if you listen to the presidential broadcast, which, I stand here, or I am seated here to thank Mr. President for that broadcast, which was easily one of the best in terms of the way it's structured, in terms of delivery, in terms of everything. What did Mr. President say? Mr. President said that we will approach this issue through proper guidance, through professionalism, and being systematic. And that's just the thing. You see, and I did say earlier on, we also need to take on board the realities of our own situation. If you say everybody should start wearing masks, do you have enough masks? So these are some of the things that have to be taken on board. We won't just come up with a policy which may be difficult or even impossible to carry out in our own situation. So those are some of the things that we need to take up, and that's why we talk of being guided by so many things, so many factors.
Now, will you say the WHO is being alarmist when it is quoted by saying the COVID-19 cases may hit 1 million in the next few days?
The WHO is not being alarming. Look at the rise in the figures, has been exponential.
Yeah, it is.
And that is the thing about COVID-19.
Yes.
The ease of spread. The ease of spread. And this is a virus that has no respect for anyone. Look at the high and mighty that have been infected and have tested positive. So that's just the WHO has a duty based on research, based on evidence, to put across to the people of the world that this is what we are getting. And it's now left for us to know how best to do what we think should be done in the circumstance.
Okay, that's taking a look at the peculiarity of Nigeria as a country. We all agree here that COVID-19 has really situated
This is the network service of the NTA. We now join our outside broadcast crew for a live telecast. Please stay tuned.
Being the economic capital of Nigeria is the epicenter of this very virus we're talking about. So a lot of things has been done. From the Ministry of Finance perspective, I'm going to break down what we've been doing or our intervention in about 4 or 5 categories. We are responsible for revenue management, we are responsible for expenditure management, we are responsible for debt management, we are responsible for investment management, and of course we are responsible for governance. So from a revenue perspective, as we will all expect, this of course will have a very huge shock on the government's revenue as businesses under economic freeze, supply chain is being hindered. So to say, businesses are underperforming, and as a direct result, government's revenue is expected to dwindle. How are we managing this? From a Nigerian perspective, we are the only state who has more than 3/4 of its revenue coming from internally generated revenue, not just depending on the federal transfers. So with this, we are able to manage our expectation, we are able to manage our assumptions, and we are responding to those assumptions on a day-by-day basis. The Finance Leadership Council meets every day to see these assumptions and make it as flexible as possible in ensuring that at any point in time, our revenue is managed in a way that we can respond to our obligation. The second line I'd like to talk about is on expenditure management. If you cannot manage your revenue, of course, you should be able to manage your expenditure. And as the Honorable Commissioner for Economic Planning had said, we are in the motion of reprioritizing our expenditures, be it capital, be it recurrent. So in that way, we'll be able to only make spends or reasonable expenditure that mirrors the revenue that is coming to the state. And that's where the revenue and expenditure platform is able to meet at a comfortable middle. And of course, on debt management. If you listen to the Honorable Minister of Finance some 2 days ago, they are talking to the World Bank, they are talking to the IMF, they are talking to multilateral organizations in terms of how they can work out some moratorium on principal and interest repayment, especially on loans that are outside of internal, that's external loans, and of course loans from the CBN. So in that way, we are also exploring debt renegotiation strategies, even with our internal loans, to ensure that our revenue and expenditure benchmark is able to really fuel the repayments of this debt. But as it is today, I can tell you that all is looking good because these are things that we measure on a day-to-day basis. I'll go straight to investment management. Investment is also a big source of income for the state, and this area is an area where we are very, very proactive in ensuring that maximum return on investment comes from all our investment assets. I'll talk also on governance and reporting, and I will scale this down to the donation. Just like you would have heard and know, Lagos State currently today enjoy a lot of goodwill from individuals, from corporates, and even governments outside, of this subnational, whereby people have supported us. They've recognized, the performance of Mr. Governor in terms of how he has shown leadership and responded to managing this very, very, global health pandemic that is ravaging everywhere in the world, and of course, Lagos. So many people have shown us goodwill and have continued to make donations, and we have went ahead to open dedicated accounts to manage these donations. So at every point in time, we know how much is coming in into those dedicated accounts, and we are taking account of that. At the end of the day, just that it's too early for us to start making, pronouncement about how much we've received or who has donated. But at the end of the day, we'll be able to show governance in terms of coming out and telling everybody how this went, who donated, how much came out, and what the money is being able to use. But what I can tell you today is that the monies being received as donation follows a governance pattern, and it will be used justifiably. I will talk also a little bit about the fiscal stimulus that the government is currently undertaking. We all know about the food bag program, making sure that as we tell people to sit at home, as we tell people to observe the stay-at-home lockdown, that we are able to provide, especially the poorest of the poor, people who are vulnerable, people who are old. So part of the monies that we collect in donations have been channeled towards ensuring that we take food bag stimulus to people who are mostly in need of it. I'll also talk about a very important fiscal stimulus that the state has actually sponsored, which is directly targeted towards small, medium-scale enterprises. For those who have loans currently running with the NSCTF, that's the Lagos State Employment Trust Fund, the Lagos State government have given 3 months moratorium to start with for principal and interest, in ensuring that these small businesses who are mostly affected by this current global health, economic crisis is not, that their pressure is able to be minimized as much as possible. My final thought is that be it individual, be it big and small enterprises, will all be affected in one way or the other. But at the end of the day, this is the time for us to show strength. This is the time for us to show purpose in terms of really looking at where this thing is going. And at the end of the day, research shows that quite a number of businesses will be adversely affected, especially the small business. But the reverse side is that when things like this come, there will be new opportunities that will be able to come up. So I want to implore every small business holders, watching us today, that look out for the new opportunities. As businesses are changing their operating models, now there are no physical meetings anymore. People are doing meetings on Zoom, they are doing meetings on Microsoft Teams, and things like that. So there will be new opportunities where businesses can tap into, and that will create a whole new level of opportunity post-COVID. Thank you very much.
Thank you very much, sir. Next, I'm going to call all of us, we live in the environment, and it is our responsibility to ensure that this environment remains sustainable. So I'm going to call the Honorable Commissioner for the Environment, Honorable Tunji Bello, to address us.
Good afternoon, gentlemen of the press, and thank you for my colleagues, for what my colleagues are doing, and so on. I think the task of the Minister of Environment since we started has been to complement what the Minister of Health has been doing. We need to help them to do a lot of prevention, and to that extent, we've started through the fumigation exercise by providing the necessary guidelines through the Ministry of Local Government and the Ministry of Home Affairs. And you could see in several local governments they have been doing a lot of fumigations across the nitty-gritty of the inner streets in several local government areas and so on. So, and many are still going on with it. We are also, the Ministry of Environment is also in charge of making sure that all our highways are properly sanitized through the fumigation exercise and so on. That one is also ongoing at the moment and so on. That's an effort with which we are trying to complement the Ministry of Health. We are also moving further. We have taxed our workforce in the Lagos Waste Management Authority to ensure proper cleaning, proper sanitation of streets, of highways, through regular monitoring of the PSP, those who collect refuse in nooks and crannies of Lagos and so on. So they'll be collecting refuse regularly to ensure that we don't have backlogs anywhere in Lagos. And all those areas where we have had a lot of backlogs in the past and so on, ensure that we use this exercise of lockdown to clear all those garbage across the states, and it's still ongoing at the moment. And also, we are also doing a lot of work on our dump sites, Olushosu, Solus, and so on. Work is also going on there to ensure that there is a linkage between the collection and disposal, and that will continue. We have moved further, and we are also looking at, we are in the rainy season now. The drainage work has started. We have started work with all the primary channels. We have started with all the secondary channels. And we are also going to be complementing the local governments, ensuring that we work together to ensure that the tertiary drains in different local governments are also cleared at the same time, to ensure that we don't have flooding. Because these are some of the ways by which you can ensure that our streets are clean and so on. You can do a lot of prevention through that process. In addition to that, we have also asked some of our agencies like LASEPA, LASWAMO to complement the effort in areas of lockdown. We ensure that the nightclubs and several entertainment places do not operate and so on. LASEPA has been doing that, and the LASWAMO, that's Lagos State Wastewater Office, they have been trying to ensure that, to complement some of the companies that are working at the moment to ensure that the wastewater as well as some of their effluents are properly cleared as when necessary, and several other things. So these are some of the things that we are doing to complement what the Ministry of Health is doing, because it is very, very important that as the Ministry of Health has done tremendous work for us in trying to ensure that this thing is combated and so on. We need to seriously ensure prevention in several areas, and that is why we have to LOMA, the Office of Drainage Services, LASEPA, everybody, we have to put them to task to ensure that they properly do normal cleaning and ensure that Lagos is free of any of this pandemic. Thank you very much.
Thank you very much, sir. Well, to show that the Lagos State government is also mindful of our young ones, the adolescents, and the children who do not have the opportunity of being in school presently, the Ministry of Education is also on top of the game. So I'm going to invite the Honorable Commissioner for Education, Mrs. Folashade Adefisayo, to tell us what the ministry is doing at this point in time.
Good afternoon, my colleagues and gentlemen of the press. Thank you very much for having me. I think when the lockdown first started, our first thought was, how would our children keep learning? We were very worried about the inevitable learning slide that would occur when they are at home and not sufficiently occupied. And so we started to wonder about the best way to reach them. There were many options. There was the internet. Many people gave us e-solutions. But we found that majority of our students have little or no access to the internet, but they would have access to mass media such as radio and television. And so we asked radio stations and television stations, some of who are here, to support us in continuing to teach over this period, no matter how long it is. And one or two stations came to our support, gave us airtime, and we started classes about 2 weeks ago. We started with SS3 because we wanted them to revise for WAEC, and so we picked the 9 subjects, some because every student does that, and some because students have a lot of difficulty managing those subjects. And we had our teachers rehearse, prepare, and deliver these lessons, and we're very glad to say that the reaction has really been wonderful. They've been playing on Wazobia TV now every day, and on Friday we have panel discussions where our teachers actually sit at the panel. Right now, because we are not going out, online of course, and children throw in their questions. I think the last Friday, there were about 1,000 responses on WhatsApp to the panel discussion. And I myself, I just before I came here, I was on TV, I was on radio, and talking about the initiative. And apart from that, we have also started classes for our GSS 3s, that is GSS 1 to 3. This is happening on Niger FM 102.7, and we are working in conjunction with South Saharan Social Development Organization. They've given us their material, and our teachers too have adapted it to our own curriculum and to our own methodologies, and this is also going on online. So we are reasonably certain that as children are learning at home. And apart from those two, for our primary school students too, we have programs on Lagos 107.5, we have Kokoka and Labeigi Urumbu, and these are still going on because, you know, at that age we have to make learning fun. We can't make it too serious. And also right now as I speak, we are not relenting. We keep on asking for support, and we are in advanced talks with a television station that has agreed to give us slots every day, and there we are going to work on the co-curricular subjects. You don't want it to be all the serious subjects like biology, maths, and so on. So there we'll have things like motivational speech, arts and crafts, STEM education, how to build a robot online, and so on. So that's the first thing that we're doing. And I must say that we've got a lot of support. We are also concerned about moving our children to e-learning, and we are cognizant of the fact that they may or may not have access to devices. And therefore, we've entered into a very, very exciting collaboration with First Bank to provide 1 million devices for students. We are working actually with a company called Rodocate, and they are providing the device. The device has the Nigerian curriculum on it. It has tests and quizzes, and I'm glad to also say that MTN has also given us airtime on these devices. First Bank has set the ball rolling. We are trying to ask the public to support us in providing these devices. Well, we ourselves, of course, will fund some of it. And what First Bank has set the ball rolling with 20,000 PCs. Edfin, Microfinance Bank, has also given us devices for our teachers, and so we are reasonably, and we are now looking for managing the logistics of getting the devices to the students. But this means that they too will be able to work on their laptops. So that's what we are doing during this period, ensuring that the learning continues. And of course, we have to start thinking about the future, because one thing is sure, we all know from this pandemic, is that life is not going to be the same again. And so because it's not going to be the same, we have started thinking about post-COVID, and we are doing things like scenario analysis. What is the most likely scenario? What's the best case scenario? And how do we react to all these scenarios? But one thing is certain, that we really, really have to move a lot of the things that we do online, and we do have to engage more seriously with technology. Thank you very much.
Thank you very much, ma'am. Next, I'm going to call the Honorable Commissioner for Youth and Social Development, Honorable Sheikh Daudu, to address us.
Good afternoon, gentlemen of the press. Good afternoon, my colleagues. First of all, we all know that our youth are very active, majority of this population, and we know that the stay-at-home affects them a lot. They all want to be out there doing one thing or the other, but we have continuously engaged them to ensure that they obey the directives of the government in terms of social distancing and staying at home. Of course, we had to close down all sporting activities in the state because we cannot afford to have people infected at this time, at this point in time. So they are much affected, but we have continuously, through different fora, engaged them, and we'll continue to engage them to talk to them to make them understand that it is in their own interest, for the safety of life of everybody, for them to obey this directive of government. We know it is not easy for them, so we make sure we continue to do that on a daily basis. Some of them are part of the volunteers in these different efforts of distributing relief packages from different local governments and through the Ministry of
Averting this pandemic. What we made on ground 14 days ago was a minister and his colleague or Minister of State and all the entire staff of the FCT really committed and working extremely hard to prepare for this fight against this monster COVID-19. And since then, Mr. Minister, we have worked with your diligent staff very closely in terms of getting the facts right and the processes right so that we can advise you accordingly. Before I hand over, since it is not the members of the press and here, they will hear directly from you the effort that is being made so far, where we are, where we were, where we are at now, and where we are going. I must, with your permission, single out for commendation the staff of your Health and Human Services Secretariat. They have been very exceptional in this assignment, particularly Dr. Kau, Dr. Ashekini, Dr. Josephine Okechukwu. These are really heroes. As well as all your other staff in FCDA, particularly Department of Engineering, Engineer Jato and the rest of them, and all others, in the public affairs unit that are particularly handling the situation room, people have been very diligent. Our work is cut out for us. Mr. Minister, we must not rest on our oars until we win this battle, inshallah. Mr. Minister, thank you.
Thank you very much. That was the Chairman, Ministerial Advisory Committee on COVID-19 in the FCT, Dr. Aliu Modibo. Round of applause for him. It is my privilege at this point to invite the Honorable Minister of the FCT, Malam Muhammad Musa Bello, to please proceed with the address. Sir.
The Honorable Minister of State, Minister of the FCT, Dr. Ramatu Tijani Aliu, the Permanent Secretary in the Ministry of the FCT, Sir Christian Chinyaka Oha, our very distinguished former Minister and Chairman of the Ministerial Advisory Committee on COVID-19, Dr. Aliu Modibo Umar, the very distinguished Vice Chairman, Professor Abdul Salam Nasidi, all the very distinguished sub-chairmen of the various committees of the Ministerial Advisory Team, our very distinguished heads of the FCT Medical Services, the Chief of Staff, directors of the Ministry of the FCT, distinguished gentlemen and ladies of the press, good afternoon. On behalf of the FCT administration, I would like to welcome you most sincerely to this press briefing, deliberately chosen in the premises of our agency that interfaces with the private sector, that is the Abuja Enterprise Agency. This is to underscore the importance that we as an administration attach to our relationship with the private sector in Abuja, because the development of this city, the vibrancy of this city, the socio-economic activity of this city has all been driven jointly by government and members of the private sector. And that's why the FCT administration decided to constitute a ministerial expert advisory team made up of very distinguished ladies and gentlemen resident in Abuja that are basically independent, people who are on their own, and people who have been able over the years to have made a very distinguished mark in their endeavors. And on behalf of the FCT administration, and indeed the entire residents of the Federal Capital Territory, I thank you most sincerely. Permit me to begin by expressing my personal gratitude and the profound appreciation on behalf of the FCT administration to the Ministerial Advisory Expert Committee on COVID-19, ably led by my very close friend and elder brother, former Minister of the FCT, Dr. Aliyu Modibo Umar, who is leading a private sector initiative to help us in this fight against this virus that has become a global pandemic. I have always said that fighting this virus requires the collective effort of all, and as has been acknowledged, Dr. Modibo's team heeded our clarion call and have worked extremely well by devoting time, expertise, and personal resources to help us all. We thank you very much, sir. As you are aware, yesterday, a few days ago, 7 patients were discharged from the Isolation and Treatment Center at the University of Abuja Teaching Hospital. God willing, several more, we are informed, are said to be discharged in the coming days if all their tests come out negative. I once more wish to commend the efforts of the medical personnel who are working in the front lines of this battle, represented here by the Secretary of Health and Human Service Secretariat, Dr. Mohammed Kawu, and the head of our Public Health Department, Dr. Josephine Mwachuku, and many others that are too numerous for me to mention. However, as it is well known, the fight against this virus, the best weapon is prevention through public enlightenment and sensitization. This, as an administration, we have tried to do via stakeholder engagements with religious leaders, political leaders, trade organizations, and indeed traditional rulers. We have showed them and we've tried to explain that really, with respect to the well-known adage that prevention is better than cure, I think this is the really most relevant disease where really and truly prevention is better than cure. And I want to use this medium to thank all these stakeholder groups, including the subgroup of the Ministerial Advisory Expert Committee, that is the group handling media sensitization, for the very good job done, and to continue to appeal that we all work harder and extend our work deeper, so that God willing, within the next few weeks, we hope we'll be able to see the end of this pandemic. Following the presidential directive on the cessation of movement in the FCT and to other states, it is well known that we began full implementation of this directive, which has already largely been successful, except in some pockets of areas in some satellite towns, which we are working with the relevant agencies to make sure that this is taken care of. I want to also once more reiterate that the lockdown is meant to curtail the spread of the virus within communities. Violation of this directive will give us no choice but to employ even stricter measures of enforcement. There is a need for us to flatten the curve in the FCT as we continue on each day to record new cases of infection. We have also, as part of the sensitization mechanism and also as a means of being able to track what is happening, establish an operational room that is working for 24 hours, manned by relevant officers of all the agencies that are involved in this fight. And I want to use this medium to thank most sincerely the head of that operational situation room, Dr. Jummai Ahmad, who is seated with us here, and her very dedicated team of young men and women who have been working day and night to make sure that information is disseminated, and also helping us to reach out to the lowest level within the grassroots at the area council level. I want to use this opportunity to thank all the volunteers, especially also the journalists who are part of the various committees who have been devoting their time to spread our message via the various media platforms provided. Gentlemen of the press, if, and we really pray to God Almighty for this not to happen, we witness a dramatic rise in positive cases in the FCT, we have already put in place medical facilities that will accommodate this increase. Apart from the Isolation and Treatment Center at the University of Abuja Teaching Hospital, which in partnership with the relevant agencies and the NCDC, we were able to add some additional facilities there. We also have other facilities in the pipeline, which I will explain to you now. But I would like at this juncture to personally, on behalf of all of you, thank most sincerely the Ministerial Advisory Committee for their intervention at the Gwagwalada Teaching Hospital, where they provided a large 350 kVA generator to provide additional power to that facility. Thank you very much. As part of the efforts being made to expand available bed spaces in isolation and treatment centers, we in the FCT administration, based on expert advice from our medical secretariat as well as our other colleagues within the medical field, we have converted the Asokoro District Hospital has now been designated as an isolation and treatment center that can cater for up to 100 patients with a large number of rooms which can be provided for intensive care patients if the need arises. And I must also add at this juncture that this particular facility is being expanded in partnership with financial institutions who have come in as a team under the auspices of your committee, that is the FCT Ministerial Advisory Expert Committee. Once more, we also thank you for this. Staff in the categories of doctors, nurses, drivers, cleaners, and indeed all those who will have contact with patients or potential patients have been trained, are in the process of being trained, and I'm sure later during the course of this afternoon the relevant experts in our medical secretariat will be able to update you on that. And the whole idea is the training is being concentrated on safety, because basically, as you all know, the FCT is proud of having one of the best crop of medical personnel across Nigeria. And any opportunity I get, I want to thank them, and I want to thank them for the good work they are doing here. But as you know, it's very important for our frontline defenders and fighters for these cities to first and foremost be protected. And the training is concentrating on how they are going to protect themselves using the relevant equipment that we have already provided and are providing continuously. In addition to the Asokoro Isolation and Treatment Center, we also have the Idu Isolation and Treatment Center, which can accommodate up to 300 patients. And this facility is being largely furnished through private sector efforts, being spearheaded by this committee, for which we are also very thankful. And publicly, I think I need to reiterate our appreciation to the CCECC Construction Company for providing the technical support in terms of reconfiguring the building to accommodate our needs. Particularly, they provided